I'm Art Kaplan, and I'm at the Division of Medical Ethics at NYU. So, where do patients go, your patients, when they need medical advice? Do they call you or email you and ask questions about they might have about trying out different remedies or preventive agents? Should they be eating their blueberries? Do they go to the internet and see what reliable sources are up there, vetted sites that are peer-reviewed and trustworthy? There are many of those, and hopefully they get some information there from the Mayo Clinic site or the NIH site or the FDA or perhaps just saying Medscape or WebMD type sites. So those are carefully checked for accuracy. Well, all too often where they go is to a celebrity. Celebrities play a large role in advertising products, whether it's Goop and the kind of strange business that has evolved around that particular company's offerings using many different celebrity voices, or in the case of morning sickness, the spokesperson who's been advertising heavily for Bonjesta is Kim Kardashian. Now, Kim Kardashian may be a wonderful person. I don't know. I never met the woman. I don't know much about her. I see pictures of her all the time. But she's certainly not someone who went very far in her science and medical education. Probably stopped around her high school days and not much more, I would venture to guess, than that. Nonetheless, the company uses her as their spokesperson. Here's a quote from her. "You know how sick I was when I was pregnant? I could barely get out of bed. That's when I found a safe and effective medicine to treat my morning sickness when diet and lifestyle didn't help. If you're pregnant and feeling sick and changing your diet and lifestyle, ask your doctor about Bonjesta." How many times have we seen these ads fueled by celebrities where they're saying, and ask your doctor? I have a couple of things to say about this kind of celebrity-driven direct-to-consumer advertising. If your doctor needs to find out from you about what Kim Kardashian said you ought to be trying, you probably need a new doctor. It isn't the case that Kim is a reliable source of information, and doctors who don't know about morning sickness on their own through reading and studying and education, I doubt there are very many of those. When someone says, and if you have any side effects from taking this, and then goes into that long, morbid spiel about all the things that could happen, talk to your doctor. Well, hopefully you would be talking to your doctor if you had any of these side effects, and hopefully you wouldn't be learning about them in a commercial. Celebrity-driven direct-to-consumer advertising is one of the things I think that keeps drug prices high, that gins up demand for things that aren't necessarily the best for the patient. There are relatively few ads for lifestyle changes or for generic substitutes for name brand things. And it gives a false sense of trust and security when you have someone that people admire giving this kind of message, or clever advertising arrangements that make people think they're getting all the information they need. I think the time has come for medicine to really say enough with the celebrity ads, enough with the direct-to-consumer advertising. We ought to go back, as almost every other country in the world has done, to leaving this to doctor-patient discussions. When I need a drug, I want a doctor who knows how to prescribe it, a doctor who knows what's the best drug for me, and a doctor who can tell me all about the side effects. I really don't want to learn about them at dinner from a celebrity. I'm Art Kaplan at the Division of Medical Ethics at NYU. Thanks for watching.